I think all of you know my name is Judy Johnson. I've been your host for these sessions, but I'm also your presenter today. I am a registered and licensed dietitian, licensed to practice in the state of Kansas. I'm a research instructor in the Department of Population Health at the KU School of Medicine in Wichita. I spent 18 years practicing clinical and management dietetics in hospitals in the Wichita area before leaving dietetic practice in 1989 and going into public health research and practice. So I have a lot of years of practicing dietetics, and I have maintained my credentials even though I don't practice per se. We're going to talk about healthy eating after cancer today. I am also a 27-year survivor of breast cancer, so this is a topic that's near and dear to my heart. So if you look at this slide, this is looking at all the different kinds of cancer that are associated with obesity. And as you can see, there's quite a list of them. And we know that obesity and cancer are related, although it's not totally understood what that relationship is and why, or what the mechanisms are. We know that inflammation, which is a hallmark of cancer, has been linked to obesity, and that inflamed fat tissue seems to increase cancer risk more prominently than the obesity itself. But again, the full understanding of how this works is not clear. As you look at my slides over on the right-hand side, you'll see the references for the things that I'm including. This is a diagram of metabolic syndrome, and sometimes people call this syndrome X. Metabolic syndrome is related to obesity, and factors of metabolic syndrome tend to be tied together or occur together, and it does increase your risk for type 2 diabetes and heart disease. And heart disease, because of the toxicity of the chemotherapy, heart disease is a major concern for cancer survivors who've received chemotherapy. But this is a diagram from Dr. LaSalle, who was in the Chicago area when he gave this to me. I'm not sure where Dr. LaSalle is now, but I think it's a great graph of how metabolic syndrome works. Most people who are overweight are genetically predisposed to that. And as you gain weight, we tend to increase more insulin. So hyper or high insulin, anytime you see MIA at the end of something, that means in the bloodstream. So as we gain weight, we tend to produce more insulin. Insulin is a hormone, and it actually has the function of moving blood sugar or the glucose from the food we eat from the bloodstream into the muscle cells, and it's in the muscle cells where it can be used for energy. And so as we gain weight, the fat pad is wider, and so it requires more insulin to move the glucose, and so we end up with hyperinsulinemia. In metabolic syndrome, over time, we end up with insulin resistance. In addition to moving the glucose, insulin has kind of a lock and key mechanism on the outside of the muscle cells that actually allows it to get that glucose into the muscle cells. It's the key. And over time, with hyperinsulinemia, we also develop an insulin resistance to where the keys don't work and locks very well. And so even though we may have adequate insulin, it may not be effective at getting the sugar into the muscle cells where it can be used for energy. Along with that comes dyslipidemia. Lipids are fats. Dys means out of whack or out of proportion to one another, again, in the bloodstream. In particular, the HDL, which is the good cholesterol, seems to be depressed, and triglycerides are increased. If we are unable to get the glucose out of the bloodstream and into the muscle cells, the liver tends to store it as triglycerides, which is a fat. And so we see these lipids out of whack or out of coordination with one another, and the term is dyslipidemia. High cholesterol, low HDL, which is the good cholesterol, and increased triglycerides, which is that glucose that's been stored as a triglyceride or a fat in the liver. The next stage of metabolic syndrome is hypertension or high blood pressure, where the walls of the arteries are not as flexible, and therefore there's more pressure in the blood vessels. And so when the heart pumps, it's getting some pushback. I like to think about it as if you've ever made a pickle, you know that you start out with a cucumber that is firm but not necessarily crisp. And if you put it in this solution of sugar and vinegar, it tends to crisp up. And that's kind of what's happening with your arteries as well. And over time, as this syndrome continues, the individual develops prediabetes or an impaired glucose tolerance, and then ultimately can develop type 2 diabetes. So metabolic syndrome is a major risk for type 2 diabetes. We know that metabolic syndrome is linked with obesity, as I just showed you. As you increase the fat pad, you increase the need for insulin. And as we develop high levels of insulin, we also develop some of the insulin resistance. And there's another hormone called, that's insulin-like, called growth factor 1, that tends to be part of this as well. And growth factor 1 is primarily in children, but in adults it behaves more like insulin. And we know that the insulin and metabolic syndrome and obesity and insulin-like growth factor all have roles in the development and progression of cancer, as well as other chronic diseases like heart disease and hypertension and type 2 diabetes. We know that sex hormones are associated with obesity, and in obese postmenopausal women, fat tissue is the main source of estrogen production. And there are increased estrogen levels observed in obese men, and testosterone levels are significantly decreased in obese men. High estrogen levels are associated with significantly increased risk of postmenopausal breast cancer, ovarian cancer, and endometrial cancer. And you see the reference down, multiple references at the bottom of the slide. And you've probably seen these diagrams of apple versus pear-shaped bodies, and people who have metabolic syndrome typically have the apple-shaped body, which means they're storing their fat around the midsection of the upper body. This body type is common in men and women during menopause, and it increases the risk for heart disease, high blood pressure, and stroke. It is thought that having a pear-shaped body does not increase your risk of diabetes, heart disease, and other complications of metabolic syndrome. And the excessive fat tissue does increase hormones and cancer risk, however, because there is excessive fat tissue, but it tends to be more around the hips and thighs. And the pear-shaped body type is more common in women prior to menopause, and there is an increased risk of insulin resistance and inflammation. As I said, there is a positive association between obesity and type 2 diabetes with the risk of cancer and cancer-related mortality. I've given you a number of references here. There's been quite a bit of research. Although the mechanism is not fully understood, we know that there is a positive association. We know that low-level inflammation over time can cause DNA damage that can ultimately lead to cancer, and that fat tissue produces excess estrogen, which is associated with increased risks of breast, endometrial, ovarian, as well as some other cancers.